Absolutely. All right, we need.
I think it's okay on our side. It's Mr. Waxman.
Starting, I mean, everybody's going to just come in for their opening statement.
Yeah. Okay.
I don't know. Let me check.
See here.
I mean, it could.
Okay.
I mean, the only thing is we'll wait a little bit if we don't have the people.
Yeah.
I
Okay.
think Phil Barnett is looking up where Mr. Waxman is.
Okay. Is Fred here? We've got a couple of members. 3 minutes.
Do you want to wait?
No, it's 3 minutes for each of us and the chair, and then 1 minute for everybody else.
Mr. Pitts,
Okay.
they're checking to see if Fred's.
Okay.
Is that? No, that's not him. No, he still has his hair. I don't think that's him. Wait, let me see a picture of him. Maybe he just knows that it's him. But he goes to a school and he's getting a gift from I've been at the White House. It's really cool. You gotta turn around a little more. I can't. That's definitely. Well, you could probably go. No, that's not him.
I think we'll go ahead and start. Okay. Subcommittee will come to order. Chair recognizes himself for an opening statement. The bill we are marking up today, H.R. 452, repeals the Independent Payment Advisory Board, or IPAB, created by Sections 3403 and 10320 of the President's Health Care Law. The purpose of IPAB is to reduce Medicare's per capita growth rate. The board will be composed of 15 individuals nominated by the President with the advice and consent of the Senate, who will be paid $165,300 a year and serve 6-year terms. If Medicare's annual per capita spending is determined to exceed an arbitrary target growth rate, the board is charged with submitting to Congress a proposal to reduce Medicare spending growth. These recommendations will automatically go into effect unless Congress passes legislation that would achieve the same amount of savings. Supporters of IPAB tell us that there's nothing wrong with having 15 unelected bureaucrats making binding decisions about Medicare policy. They're not troubled by the fact that there is no requirement for public comment prior to IPAB issuing its recommendations. That IPAB's actions are not subject to judicial review does not alarm them. Supporters point to the fact that IPAB is not permitted to ration care. The definition of rationing, however, does not appear in any federal law, including PPACA, to my knowledge. For example, is it rationing if IPAB slashes provider reimbursements to the point that doctors decide they can no longer see Medicare patients? That's already happening in many parts of the country. Further provider cuts will only exacerbate that trend. And if you are young and healthy and believe that this debate doesn't impact you or won't for decades, you may be interested to know that IPAB is also charged with submitting to Congress annual detailed reports on health care cost, access, quality, and utilization, and recommendations regarding ways of slowing the growth in private national health care expenditures. IPAB is the exact opposite of transparency and accountability. It is merely another example of valuing centralized decision-making by government-appointed experts over judgments that should be made between a doctor and patient. That Medicare is on an unsustainable growth path is undeniable. That IPAB is not the way to fix the problem would, I hope, be self-evident. I'm pleased that H.R. 452 has a bipartisan group of co-sponsors, including members of the full committee from both sides. I urge support of the bill. And anyone seeking time on they'll have I'll yield the remainder of my time and now recognize my friend from New Jersey, Mr. Pallone, for his opening statement.
Thank you, Chairman Pitts. I wish I could say I was happy about today's markup to repeal the Independent Payment Advisory Board, better known as IPAB, but I'm certainly not. I've made it clear from the infancy of the idea that I was opposed to IPAB, but the reasons for my position are not the same as my Republican colleagues. I don't think this markup was real, Mr. Chairman. This is an effort by the other side to continue its political game of defacing the Affordable Care Act. All the Republicans want to do is repeal the ACA piece by piece, and today is simply another attempt in those same efforts. My opposition to IPAB focuses on my belief that Congress must stop ceding legislative power to the executive branch. For me, this is about congressional prerogatives being limited. IPAB, like other independent commissions, encroaches upon legislative authority. I'm opposed to an independent commission playing a legislative role other than on a recommendatory basis. It's not the job of an independent commission to make decisions on health care policy for Medicare beneficiaries. Now, I simply can't stay quiet about the rhetoric, however, from the other side. How can the Republicans lecture anyone about IPAB and its consequences for Medicare and seniors? You purport to want to protect Medicare and seniors, yet last year every single one of you voted to end Medicare as we know it. Your budget destroys Medicare. You turn the program and millions of seniors over to the private insurers with no accountability. In fact, the Republicans' Medicare plan would more than double the typical seniors' out-of-pocket health care spending in 2022 compared to what their costs would be under traditional Medicare, increasing their out-of-pocket costs by more than $6,000. So let me be clear. My vote today in support of abolishing IPAB is not related to my support for the ACA. In fact, I do not see IPAB as a significant factor in the Affordable Care Act. The ACA has finally set our health care system on a path to reform, and I wish the Republicans would simply embrace the ACA and not use the IPAB as a reason for its repeal. My hope is that we can work together to build on the success of the Affordable Care Act's reforms. Thank you, Mr. Chairman. I yield back.
Chair, thanks, gentlemen. Now recognize the chairman of the full committee for 3 minutes for an opening statement.
Thank you, Mr. Chairman. I'm just going to submit my statement for the record to speed things along. So with that, I'll yield back.
What did he say? I didn't hear what he said. All right. Do I go to this side? Chair now recognizes the ranking member of the full committee, Mr. Waxman, for 3 minutes for an opening statement.
Thank you, Mr. Chairman. Today, the Republicans are mounting another political attack on the Affordable Care Act. For the last year, House Republicans have been claiming, erroneously, that we cannot afford to maintain Medicare's promise to seniors. Yet today, they will vote to repeal provisions in the Affordable Care Act that will save Medicare over $2 billion. And they have identified no way to pay for the costs they're adding to Medicare. Their logic makes no sense. They say we can't afford Medicare, yet they want to eliminate one of the innovations in the Affordable Care Act that keeps Medicare costs under control. It is this kind of political opportunism that is alienating so many Americans from Congress. The fact is, the Affordable Care Act is working. It is not quite 2 years since the enactment of this historic legislation, and already it is driving down health care costs and increasing health care benefits. Last year alone, nearly 4 million seniors and people with disabilities in Medicare saved over $2 billion on prescription drugs as a result of the Affordable Care Act. Over 30 million seniors received free preventive services. At the same time, actuaries now estimate that Medicare costs will be over $100 billion lower in 2020, due in part to the reforms Congress enacted. It is not only seniors in Medicare who are benefiting from health reform. In the private marketplace, over 2 million young adults now have health insurance coverage thanks to the new law. Over 50 million Americans received expanded coverage of preventive services, and 50,000 Americans now have health coverage through the pre-existing condition insurance pipeline, a lifeline for those with cancer, AIDS, and other conditions that make them ineligible for coverage in a marketplace where insurers are allowed to discriminate based on pre-existing conditions. And now, as a result of the Affordable Care Act, insurers who want to hike their rates by 10% or more have to justify it. The law shines a spotlight on unreasonable rate increases, and many have been denied saving consumers money. The facts are in, and they show the Affordable Care Act is working, but my Republican colleagues want to deny reality. They seem to have an obsession with undermining a program they call Obamacare, even if it would leave millions of Americans, including seniors in Medicare, at the mercy of insurance companies. Today's target is the Independent Payment Advisory Board, IPAB. IPAB was created to be a backstop, and let's be clear, that's what it is, in the event that the other delivery system reforms don't fully achieve the expected results. We all hope the IPAB will be irrelevant. If the Act works as expected, it will be. But in either case, beneficiary benefits and access to care will be protected. That's not the case under the Republican plan. Their idea is to shift costs to beneficiaries, end the Medicare program, and replace it with a voucher. Costs to seniors would skyrocket by $6,000 in just 10 years. There are aspects of the IPAB that could be improved. Some on our side of the aisle have legitimate questions about its intrusion into the prerogatives of Congress. But it sure beats the Republican alternative. That's why we should give the positive changes in the Affordable Care Act time to work. That's why the discipline of having a backstop like IPAB makes sense. Let's recognize today's markup for what it is, an attempt to discredit the Affordable Care Act and embarrass the President. This bill may pass today, and it may pass the House, but it is not going to pass the Senate, and it's not going to be enacted into law. The American people are getting frustrated with Congress. They want us to stop posturing and start addressing their needs. Regrettably, today's markup is another demonstration of how out of touch this committee has become. Mr. Chairman, that completes my statement, and I yield back.
Chair, thanks, gentlemen. Chair reminds members that pursuant to committee rules, all members' opening statements will be made part of the record. Are there further opening statements? Gentleman from Mr. Rogers, recognized for 1 minute.
Thank you, Mr. Chairman. I am a bit shocked at the lack of concern of what this bill is doing to average Americans. I heard from two of my colleagues on the other side that they were worried that that we're ceding authority from Congress to the administration, how terrible that is, so that we were worried about the prerogative of Congress versus the prerogative of the executive branch. About $500 billion in cuts to Medicare happened today. 30% of doctors have already restricted new Medicare patients from getting treatment. That's today. I don't really care about Congress or the President or the executive branch. I care about my seniors in my district who are being punished by the passage of this bill. And to make matters worse, we're going to have an unelected board that gets to ration health care for the future by cutting costs arbitrarily to doctors. They have already said they are changing the way they practice medicine for the worse because of the passage of this bill. So we can spend a lot of time, for my colleagues on the other side, worried about Congress's authority or the President's feelings. I feel bad about his feelings, I do. Other than the fact that I have senior citizens who are scared to death because they can't find a doctor to take them under Medicare. That is the atrocity of this bill, and I look forward to this passage and reforming this bill by eliminating it from the books.
Chair, thanks, gentlemen, and recognize the Chair Emeritus, Mr. Dingell, for 1 minute for opening statement.
I'm very distressed this morning. It seems that the Congress can't leave any decisions made by us earlier alone and to allow us to then build upon things which should be settled. frankly, the Congress is held in slightly higher esteem than child molesters. And I'm hopeful that when we have concluded this session, we will still be a little better off than that. A Chinese just recently had something to say about the United States. He said, America is at the terminal phase of historic decline because the political system is unable to make difficult and important decisions timely and carry them out in a tough-minded way. That should be a warning to everyone hereabout that we are not able to do our job. I don't know why this committee is spending its time constantly trying to repeal, in whole or in part, all of the Affordable Care Act and a lot of other legislation that's already passed. But if one thing is very clear, while we're moiling and toiling around on these things, we are incapable of doing the things that we're supposed to. Where is the budget? Where are all of the other proposals? And the interesting thing, the one thing that is perhaps going to cut back on costs is attempted on the part of my Republican colleagues to be repealed. I think we ought not waste the time of this committee on this piece of legislation. We ought to get together and start legislating the way we should and to stop some of this nonsensical behavior that, quite frankly, is diminishing the Congress's respect in the minds and the eyes of the public.
Chair, thanks, gentlemen. Recognize gentleman from Pennsylvania, Dr. Murphy, for 1 minute for opening statement.
Thank you, Mr. Chairman. Let's get down to the basics. The Independent Payment Advisory Board raises the fundamental question about who you trust to make decisions about your health care. Is it an enlightened and unelectable panel of bureaucrats appointed politically and tasked with calculating the correct reimbursement amounts for your doctor, what can be paid and how much will be paid? Or do you believe that decisions on price and valuing care are better off left to doctors and also the colleges and academies of medicine in terms of what are the proper protocols to follow for health care? In this past month, we've already witnessed a remarkable assault on religious liberty through government action on the Patient Protection and Affordable Care Act. If we ignore the assaults on liberty and faith by a similar panel of Washington experts, what can we expect to happen to seniors if we allow them to make decisions on health care? All state, local governments and administrators should all be concerned about this and should make decisions based upon medical proper care rather than have government make those decisions. I yield back.
Chair, thanks, gentlemen. Recognize the gentlelady from California, Ms. Capps, for 1 minute for opening statement.
Mr. Chairman, over the past year and a half, I've spoken with many people on all sides of this issue, patients, providers, and many other stakeholders. I understand the concerns about IPAB, particularly from those in the provider community. Indeed, I share many of them, but I'm troubled by two aspects of this bill and the debate. First, we've all agreed that we have to get health care costs under control. This bill doesn't address that issue at all. It simply repeals a good faith effort to bring health care costs under control in a manner that tries to protect seniors and ensure that they still get quality care. I am interested in finding a way to address the very legitimate concerns that many in the provider community have with IPAB. But simply repealing IPAB while making no attempt to come up with an alternative is really not an answer. Second, I'm concerned that the bill's authors do not identify exactly how we will pay for the estimated $2.4 billion CBO says repealing IPAB will save. The size of our debt has consumed debate here in Washington and across the country. This bill only adds to our deficit problems. It is those two reasons that will reluctantly lead me to vote against the bill as it is currently drafted, and I yield back.
Chair, thanks, gentlelady, and recognize the Vice Chair of the committee, Dr. Burgess, for 1 minute for an opening statement.
Thank you, Mr. Chairman. Thank you for holding this markup. IPAB does represent the worst of all possible worlds, and I'm glad we're taking the first steps to get rid of it. As a physician and member of Congress, I'm deeply offended by what is known as the Independent Payment Advisory Board. It's not accountable to any constituency and cuts provider payments to mathematically fit a target. Given that private insurers use Medicare as a benchmark for their own payment changes, this Independent Payment Advisory Board will have far-reaching implications far beyond Medicare. This is not a solution in search of a problem, however. Medicare's unfunded liabilities total over $24 billion under the current baseline. The long-range financial imbalance of just Part A would require an immediate increase in the payroll tax of 24%. That's why Republicans have advanced plans to keep Medicare solvent so it will be there for future generations by lowering the cost to the federal government while providing better access and care for seniors. IPAB is absolutely the wrong approach, and we will do patients a service by moving this legislation today. I yield back my time.
Chair thanks the gentleman and recognize the gentlelady from Illinois, Ms. Schakowsky, for 1 minute for opening statement.
Thank you, Mr. Chairman. This markup represents another in a long line of partisan political attacks on the Affordable Care Act. The ACA explicitly states that the Independent Payment Advisory Board can only make recommendations to Congress regarding Medicare and cannot make recommendations that would ration care, raise premiums, increase cost sharing, restrict benefits, or modify eligibility. Let's contrast with what my colleagues on the other side of the aisle mean when they talk about lowering Medicare costs and ensuring sustainability. What is their plan? We saw it in last year's Republican budget. Their proposal ends the Medicare guarantee and dramatically increases costs for seniors and the nation. The choice is real. The Republican plan is to eliminate Medicare as we know it and replace it with an inadequate voucher payment plan to private insurance companies. The choice is real. Oppose H.R. 452 and protect Medicare. I yield back the balance of my time.
Chair thanks the gentlelady. Recognize the gentlelady from Tennessee, Ms. Blackburn, for 1 minute.
Thank you, Mr. Chairman, and I thank you for calling this hearing so that we continue to look at how we dismantle the harmful provisions that we have found in the Obamacare bill. And I have to tell you that over the past couple of years, the IPAB is one that I have heard a lot about from my constituents, people all across my district. They know that IPAB's only option to curb Medicare spending would be to effectively refuse treatments to patients by severely cutting provider fees. That concerns them, and rightfully so. Concerns me too. We have to realize that seniors have given the federal government first right of refusal on their paycheck all their working life in order to receive health care when they turn 65 years old. And physicians are already restricting how many Medicare patients they're going to treat. With IPAB, it only gets worse. With Obamacare having pulled $575 billion out of Medicare, it makes the situation even worse. So I'm pleased we're taking this up, and I look forward to removing this bill and getting it off the books. Yield back.
Chair thanks the gentlelady. Recognize the gentleman, Mr. Gonzalez, for 1 minute for an opening statement.
Thank you, Mr. Chairman. In this 1 minute, I give another example specifically with this piece of legislation of my colleagues on the other side of the aisle opposing but not proposing, repealing but not replacing. We used to try to engage in a good faith debate about bending the health care cost curve. We don't even talk about that anymore. We used to talk about performance-based medicine, common sense, some standards out there uniformly adopted and recognized by practitioners, not by individuals that are far removed from the profession, because we cannot afford, and this is where we all agree, with the escalating cost of health care in America. This is not an exercise in finding answers. This is an exercise of simply avoiding a good faith debate that will move this forward and serve the best interests of the American public. Thank you, Mr. Chairman.
Chair thanks the gentleman. Recognize the gentleman from Georgia, Dr. Gingrey, for 1 minute for opening statement.
Mr. Chairman, I thank you very much. It was 7 or 8 months ago that Secretary Sebelius was before this committee and was asked specifically if any person wishing to challenge an IPAB decision would be able to do so through the courts. And she stated, and I quote, "Our general counsel feels very strongly on this matter that they would be able to." But when you look at Section 3403 of the Affordable Care Act, it stipulates, and I quote from that section, "There shall be no administrative or judicial review." Now, of course, the American people had the opportunity last November to go to the ballot box and make a decision. And that's why many of our colleagues on the other side of the aisle were turned out of office because of that. But this leaving that IPAB in there really gives seniors who are denied care because it's too costly or they're too old, they have absolutely no recourse in regard to IPAB. So when my colleagues say that, oh, it's just another attack on Obamacare, it reminds me of the debate on the partial birth abortion bill. which they were opposed to because of a fear of a domino effect on Roe v. Wade, even though that provision in the law was an abomination. I'm not saying abomination, abomination. So that logic clearly will not hold water here. Let's repeal this abomination of IPAB. And I yield back.
Chair, thanks, gentlemen. Recognize gentleman from Ohio, Mr. Latta, for 1 minute for an opening statement.
Thank you, Mr. Chairman, and thank you for holding the markup today on H.R. 452, the Medicare Decisions Accountability Act of 2011, of which I am a co-sponsor. This subcommittee held a hearing on the IPAB in July of last year, and the hearing demonstrated the negative consequences this board will have on American families. IPAB, as stated by Chairman Pitts, will be controlled by an unelected board which will be making decisions for Medicare patients. Doctors and families will be told by this board of unaccountable members which tests are permitted and what medical care is needed to meet standards set by the board. As with many items in the PPACA, the administration has conveniently given Congress very little oversight of IPAB. I strongly believe that physicians and patients are in the best position to decide their own health care, and IPAB must be repealed. I look forward to the markup today in supporting H.R. 452, which fully repeals IPAB, and I thank the chairman and I yield back.
Chair, thanks, gentlemen. Recognize the gentlelady, Ms. McMorris-Rogers, for 1 minute for opening statement. Mr. Lance from New Jersey, 1 minute.
Thank you, Mr. Chairman. Today, the committee will be considering H.R. 452, the Medicare Decisions Accountability Act of 2011, a bill that would repeal the Independent Payment Advisory Board. The board was established by the Patient Protection and Affordable Care Act in order to reduce the per capita growth in Medicare spending. While controlling the growth of Medicare spending is an endeavor we all share, I have strong concern that IPAB puts important health care payment and policy decisions in the hands of unelected officials with far too little accountability. Because IPAB has limited options for lowering spending, providers will likely bear the brunt of the cuts, resulting in less access to treatments and services for senior citizens. Medicare is in need of real reforms to ensure its sustainability, and IPAB undermines those efforts. I urge my colleagues to support this bill so we can work together to strengthen Medicare. I yield back the balance of my time.
Chair, thanks, gentlemen. Recognize the gentleman from Louisiana, Dr. Cassidy, for 1 minute for an opening statement. He passes. Are there any other opening statements? If not, the chair calls up at this time H.R. 452 and asks the clerk to report.
H.R. 452, to repeal the provisions of the Patient Protection
Without
and
objection,
Affordable
the
Care
first
Act.
reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Are there any bipartisan amendments to the bill? Are there any other amendments to the bill? Chair recognizes the ranking member.
I move to strike the last word.
Chair recognizes the gentleman.
Thank you very much. I just want to correct the record on a couple of points. One of the arguments we heard over and over again is we shouldn't let unelected officials make important decisions. Well, I don't think we're getting much from the elected officials these days. People may well welcome decisions, especially when it means that the Medicare program can continue to be there to pay for the cost of health care to which people have paid in and for which we have promised them that they would be protected in their retirement years. Secondly, one of the members on the other side of the aisle made comment that doctors are turning patients away or they're refusing to take Medicare cases. Well, I can assure you it's not because of IPAB. It's because they worry, the doctors do, whether they're going to get a steep cut in their reimbursement rates under the SGR. Well, we could have solved that problem, but it was Speaker Boehner who refused to go along with a permanent fix of the SGR and kicked this can down the road again. Now, that issue has been kicked down the road by Democrats and Republicans, and it's a long time we addressed it and had a permanent solution to the ridiculous SGR, which I opposed when it was offered in the 1990s. It was not very smart then, and we've seen what a disaster it is now. But that's what's driving doctors to question whether they can take Medicare patients as part of their clientele. So I think the American people ought to understand that when they hear these kinds of comments, they're not really speaking about the Affordable Care Act. We're referring to the doctors who are responding to the so-called balanced budget law in the 1990s, which balanced the budget on the expectation of paying doctors less money. And when that expectation wasn't met, doctors were supposed to have their fees dropped, and such a result would have been untenable. So Democrats and Republicans have kept the SGR from going into effect, but leaving everybody in doubt whether at the end of the year or every period of time, the elected officials will step up to the bat and solve the problem, or at least allow the doctors to continue to get their reimbursements. I think it's important to understand this, and I find it ironic that rather than fix the SGR problem permanently, we're debating in this committee a repeal of one of the efforts of the Affordable Care Act to hold down costs in Medicare. When costs in Medicare go up, Republicans say we got to cut these entitlements. And why do they propose to cut it? Not holding down the costs, but shifting those costs onto the elderly by making them pay more for their Medicare. They would do this by saying that Medicare won't be there as they've known it, but they would get a voucher, and that voucher would allow them to select different insurance plans. But the voucher is kept to such a lack of increase to meet the additional costs of Medicare that people would be facing more of the burden for Medicare on themselves. And if they couldn't afford it, well, maybe they'll be lucky enough to get a poor people's HMO, but they're not going to be able to get a plan that would be equivalent for them in what Medicare now provides. So I want to bring this out, and I think that members ought to have this clarification.
Will the gentleman yield?
Who's asking me to yield? Yes, I'll be happy to yield to you.
The reason if it was only the SGR cliff that was causing people to fall off, then the rate of non-participation would be the same between primary care physicians and specialists. As it turns out, the problem is that Medicare effectively pays below the cost of doing business for many primary care. They are disproportionately the ones who are signing out of Medicare. So I'm not sure the logic holds up. And I'm also finding it as interesting that SGR, which is kind of the hybrid of centrally planning applied to health care, supposedly doesn't work and is not good, but the hybrid of IPAP, which is centrally planning applying to Medicare in a newer version, somehow does work.
I would, yielding the time back to myself, I appreciate the gentleman's statements. He's right about the preventive and preventive care, and that we ought to pay the doctors who spend time with their patients more money. But what solution do you have? We don't see any proposal to deal with that. All we see is a proposal to cut the IPAB. That's no solution at all.
I'll ask you to co-sponsor my legislation.
And replace, but we never get a replacement.
Chair thanks the gentleman. Any other discussion on the bill? Dr. Burgess is recognized for 5 minutes.
I thank the chairman. I do also feel compelled to respond to some of the statements that we've just heard. Yeah, the Independent Payment Board is unelected individuals who are going to be supplanting themselves for what is our responsibility under Article 1 of the Constitution. This is not something that should be done by statute. It should be something that is done by constitutional amendment if the gentleman feels strongly that this is necessary to do this. Yes, doctors are turning away patients under the sustainable growth rate formula for reasons that Dr. Cassidy just articulated. The steep cuts in the sustainable growth rate formula are a result of creating targets. So the debate has been over targets that were created under the sustainable growth rate formula. Oh my God, you're creating new targets under the Independent Payment Advisory Board. And as I pointed out in my opening statement, there is not a private insurance company out there in the market of the United States of America today that does not base their fee schedule on what Medicare reimburses physicians. So in effect, the Independent Payment Advisory Board is now going to give a break to insurance companies all across the country. Well, that's a good idea, but it escapes me as to how it will be. The logic involved in the creation of the Independent Payment Advisory Board was deeply flawed. Many of the parts of the aforementioned Patient Protection Affordable Care Act were deeply flawed, and the process was deeply flawed. The ranking member remembers well when he was chairman and sat in this committee, and we spent days marking up H.R. 3200. Where is H.R. 3200 today? It is relegated to the dustbin of history. Interestingly, H.R. 3200 had a severability clause contained deep within its pages because the chairman at the time accurately recognized that the Congress would occasionally do things that were extra constitutional, and if the Supreme Court called us upon it, he wanted the rest of the bill to be able to stand if the individual mandate was ruled unconstitutional. Now we're in the conundrum over in the Supreme Court where the whole severability issue was left up to someone's guess because the Senate, either in haste or by deliberate omission, left the severability clause out of H.R. 3590, and as a consequence, we have now an actual conundrum that the Supreme Court is going to have to work through. Do they strike down just the individual mandate if they so desire, or do they strike down the entire law? And it makes a great deal of difference to the patients and doctors and nurses of America what that decision is. We could have solved that problem for them had we gone through regular order, gone to a conference committee between the House and Senate, rectified some of the problems that were in the Senate language, the Independent Payment Advisory Board being case in point, because that would never have survived a conference committee. I feel absolutely certain that the ranking member, when he was chairman of this committee, would never have allowed the Independent Payment Advisory Board to continue. To be sure, he would have had other pieces of bad policy that he would have put in its place, and I still wouldn't have been able to support it, but he would have struck down the Independent Payment Advisory Board had it been within his scope and ability to do that. Now, the sustainable growth rate formula did not, contrary to the statements just made, did not begin in the mid-1990s. The sustainable growth rate, the foundations were laid in 1988 when the RVRBS was created. I don't know whether it was by this committee or some other committee, but that's actually where the interference and the administrative pricing that began in Medicare, that's where you can trace its origins. So the problem may have been exacerbated at the Balanced Budget Act in the 1990s, but it was actually created in one of the Omnibus Budget Reconciliation Acts in 1988. So if we want to have our history, we ought to at least be accurate. And the RVRBS was done to address the question of volume. Well, think about it for a moment. Volume is not a problem, not a legislative problem. The volume of patients coming into Medicare is not a legislative problem. It's a demographic problem. Does anyone here honestly believe that the volume of patients dependent upon Medicare is actually going to get lower over the next 10 years' time? That's pure fantasy. Of course it is not. But RVRBS was created as a way for CMS and perhaps the Congress to control the doctor's activity in the doctor's office by attempting to control volume, by cutting the price down and keeping the volume pressures the same. All they did was guarantee that we were going to have these problems as they occur today. The Independent Payment Advisory Board takes all of those bad ideas and doubles down on them. That's why it's so important that we get rid of it this morning. Thank you, Mr. Chairman, for your indulgence, and I'll yield back.
Chair, thanks, gentlemen. Is there any other discussion on the bill? For what purpose does the gentlelady seek recognition?
To strike the last word.
The gentlelady is recognized for 5 minutes.
I think it's worthwhile being very clear about what the process is of the of IPAB and how it actually works. The Affordable Care Act, first of all, explicitly states that the Independent Payment Advisory Board can only make recommendations to Congress regarding, and I'll talk more about that, regarding Medicare, and cannot make recommendations that would ration care, raise premiums, increase cost sharing, restrict benefits, or modify eligibility. It's also supposed to consider the effect of its recommendations on Medicare solvency, quality and access to care, the effect on changes in payments to providers, and the impact on those dually eligible for Medicare and Medicaid. Then what they do is make the recommendation, and it goes to Congress. And Congress has the opportunity to, let me read it. It says, IPAC makes recommendations to Congress, and Congress can affirmatively act to amend or block them. Now, it is under fast-track procedures, and if Congress does that, then those are changed or amended. If not, then the recommendations do go into force automatically. So we actually do something in the government that deals with what the Republicans have been talking about for a long time, and that is controlling the cost of health care. And then who are these panel members? Panel members, it says, are expected to have diverse backgrounds as physicians and other health professionals, employers, third-party payers, representatives of consumers and the elderly. They are expected to have recognized expertise in areas such as health finance, economics, and biomedical health services. They're prohibited from any other business or employment during the time of their service. A majority of panel members cannot have been directly involved in providing or managing Medicare-related services prior to their appointment to the board, and they have to be approved by the United States Senate. So it seems to me that all of the realistic concerns are embodied in the IPAB regulations. But again, as many of my colleagues have said, what is the alternative? We know what the alternative is that we've seen so far. The Republican budget, which shifts costs to seniors and empowers insurance companies. And so if that's the choice, then it sure is clear to me that I would choose IPAB, and I think most consumers would do that as well. Under the Republican plan, it's an inadequate voucher system that makes payments to private insurance companies. Seniors are forced to make up the difference in the amount of money that is between what the voucher is and the premiums really are. The Republican budget asks seniors and people with disabilities, half of whom have less than $19,000 a year in income, to pay more and get less. That's the alternative that has been laid before us. Here we have a systematic way of looking at how to control the costs. Congress does have a say in that and can make the changes if there's a majority of agreement. So I find it ironic that my colleagues on the other side argue that we should not turn decisions over to a 15-person board that operates transparently and whose recommendations can be rejected by Congress, while they support turning Medicare over to private insurance companies that operate behind closed doors and whose decisions would not even be reviewable by the Congress. So we've got IPAB to force spending discipline, force innovative and greater efficiencies in the delivery system without harming beneficiaries. And yes, IPAB is far from perfect. We could agree if we wanted to right now on fixes that are needed, but repeal seems to be the only answer that the Republicans ever offer. So unfortunately, a political decision has been made to continue with the assault on the Affordable Care Act, and IPAB is yet another target. I think that's a real pity, and I yield back my time.
Chair, thanks, gentlelady. Is there any other discussion on the bill? Chair recognizes Ms. Rogers for 5 minutes.
Thank you, Mr. Chairman, and I appreciate the chance to speak on this legislation too. If anything, this is Congress reclaiming its proper role in determining the appropriate reforms that we will pass for Medicare. I don't think we have to look any further than 2 years ago when the United States Preventive Health Services Board and their recommendations on mammograms to see what government decisions do to our healthcare system. Moreover, IPAD is just a Band-Aid for the true reforms that Congress needs to make to save Medicare for future retirees. We have to stop making doctors the victim of an unsustainable program. The only result will be even fewer doctors, decreased access, and a lower quality of care. I urge my colleagues to support this bill and yield back. I'll yield to the great gentleman from Georgia, Mr. Gingrey.
Mr. Chairman, I thank the gentlewoman for yielding. And let me get this straight now. I hear from the other side how much they're opposed to the repeal of IPAB. They're opposed to that, and yet they're for modifying, repealing, changing SGR. And to me, that just really doesn't make a whole lot of sense, because IPAB is SGR on steroids. The ranking member, in his remarks just a few minutes ago, criticized Speaker Boehner in regard to the recent legislation trying to give the providers, the physicians, a 2-year mitigation from almost a 30% cut based on that flawed SGR formula. Well, of course the Speaker was opposed to it because the Democrats would only pay for it, they would only pay for it by raising taxes on the job creators of this country and further raise unemployment and deepen the recession. So I commend the Speaker for having the wisdom and the judgment, the good judgment, not to go along with a pay-for that was so burdensome. Now, look, in regard to Medicare, if the Democrats truly wanted to save Medicare, and indeed if they wanted to solve the SGR problem once and for all and pay for the cliff that my colleague from Louisiana, Dr. Cassidy, is referring to, they could have taken some of that $575 billion that they robbed the Medicare system of and maybe spent $250 billion to solve this cliff. But no, what they did with the entire $575 billion, including a 14% cut to Medicare Advantage, I think it totaled about $120 billion, cuts to skilled nursing homes, cuts to hospice, a tax on providers of durable medical equipment at a rate that's probably about half of their profit margin, to create an entirely new entitlement program for young people. I mean, it makes no sense. Their argument absolutely holds no water whatsoever. We need to repeal IPAB because, as I said earlier, this is an abomination. They know it. They know, but they have this fear that if we eliminate this one section, that, golly, you know, this is going to be a domino effect, and then that might possibly chink away at their armor and eventually lead to the repeal of the whole Unaffordable Care Act. I yield back to the gentlewoman from Washington. Thank you for yielding time.
I yield back. Good job.
Mr. Burgess. Mr. Burgess votes aye. Mr. Whitfield. Mr. Shimkus. Yes. Mr. Shimkus votes aye. Mr. Rogers. Aye. Mr. Rogers votes aye. Mrs. Myrick. Mr. Murphy. Aye. Mr. Murphy votes aye. Mrs. Blackburn. Mrs. Blackburn votes aye. Mr. Gingrey. Aye. Mr. Gingrey votes aye. Mr. Latta. Aye. Mr. Latta votes aye. Mrs. McMorris Rogers. Mrs. McMorris Rogers votes aye. Mr. Lance. Mr. Lance votes aye. Mr. Cassidy. Aye. Mr. Cassidy votes aye. Mr. Guthrie. Aye. Mr. Guthrie votes aye. Mr. Barton. Aye. Mr. Barton votes aye. Mr. Upton. Aye. Mr. Upton votes aye. Mr. Pallone. Aye. Mr. Pallone votes aye. Mr. Dingle.
No.
Mr. Dingle votes no. Mr. Towns. Aye. Mr. Towns votes aye. Mr. Engel. Mrs. Capps. Votes no. Mrs. Capps votes no. Ms. Schakowsky.
No.
Ms. Schakowsky votes no. Mr. Gonzalez.
No.
Mr. Gonzalez votes no. Ms. Baldwin. Mr. Ross. Mr. Matheson. Mr. Waxman. No. Mr. Waxman votes no. Chairman Pitts. Aye. Chairman Pitts votes aye. I know. She's supposed to say. Mr. Whitfield votes aye.
He voted no.
Mr. Chairman, on that vote, there were 17 ayes, 5 nays.
The ayes have it, and the bill is favorably reported. Without objection, staff is authorized to make technical and conforming changes to the bill approved by the subcommittee today. So ordered. Without objection, the subcommittee stands adjourned.